anatomy. So the talus and the calcaneus fit together like this, and there's actually 3 facets that comprise the subtalar joint. And so this is the posterior facet back here. We have the middle or sustentacular facet, and then we actually have an anterior facet up here, which kind of holds the head of the talus partially against it. And so let me just switch over and we can look at these separated a little bit. Now we can see a bit of that subtalar joint. So here's the posterior facet, and there's the posterior facet on the calcaneus. Here's the middle or sustentacular facet and the adjacent facet on the talus, and then the anterior facet. And some people this will be one continuous facet. Some people they will be 2 separate ones as I've drawn it here. And then if I bring this back down here, you can see that in between these we kind of have this channel which is called the sinus tarsi region. Okay, so that's the sinus tarsi. So that's the subtalar joint. And when we're talking about coalition, we're mainly talking about the sustentacular or middle facet, although it can be the whole way across. And so let's go and see what that looks like on MRI. So here's a normal ankle MRI on Radiopedia from Dr. Andrew Dixon, and we can see if we start here laterally that we first encounter the posterior facet of the subtalar joint, which is a little bit curved, kind of to extend up here underneath the posterior process of the talus a little bit. We can see that sinus tarsi region, which is filled with fat, ligaments, and vessels. And then we're already into the anterior facet underneath the talar head. And we can follow that over here, and then we can see that we transition, and this person does have 2 separate facets into their sustentacular or middle facet. And so this is on the sagittal plane, so let's look at it in the coronal and axial plane as well. Okay, so here's our anterior facet between the calcaneus and the talus, and then let's scroll up here a little bit. Now we're into our sustentacular or middle facet, and then if we keep coming back here, we'll go through the sinus tarsi region, and now we're up into that posterior facet. All right, and if we switch over here to a coronally oriented CT scan, we can see the comparison between a normal and a coalesced subtalar joint. And so typically we're talking about the middle facet. Of course, it can be more than that. And in this case, it's fibrous coalition. It's not a bony coalition. And so fibrous cartilage, or oftentimes I'll just say fibrocartilaginous because we're not really sure which it is. Okay, and so here's the posterior facet. And if we scroll down to the middle facet, you can see that this one is irregular. This is not a normal synovial, joint morphology with parallel articular surfaces. And then we can see the normal shape on the contralateral side. And then we don't have quite enough included here to get the anterior facet. All right. And so this is another case here, a little bit different shape to the subtalar joint. And you can see that here's that middle facet here, which has kind of that fibrocartilaginous type of coalition between the sustentaculum tali and the talus. And here's our posterior facet. And if we scroll up here anteriorly, you can kind of see that this sustentaculum is like almost has like 2 pieces to it. It has this more proximal portion, and they almost have like 2 sustentaculi. This one maybe looks like it might actually still be synovial. And then we get up here into that anterior facet down here. And they've got a little anastosis. So if we look at that in this 3D reformat that they made, you can see that here's kind of the more traditional anatomic sustentacular joint, and then here's that coalition. And then here's that anterior facet up here. And we scroll around, we can see a bit of that posterior facet. And so you can see why this would cause that continuous C sign, which is what we usually look for to detect this on radiographs, where the top of the C is the normal talar dome, and then usually there should be a little gap here. So if I switch back to my anatomic model, right, you're going to see the top of the C, and then it's going to be broken, and you'll have this